guidance because I'm going to overlap to that STL file with the new digital planning of my future restoration, the emergence of my implant, right? So remember, now I have CT scan overlapped with my STL file, and I can, out of that digital WhatsApp or digital creation of the future tooth, I can understand which is going to be the most proper direction of my implant. Once I get that, I create my own guides. I design my own guides. I even put the name of the patient or the size of the implant that is going to be needed to be placed right here, and I can already go and use it in my surgery. So we have original anatomy, right? We have a virtual extraction. We have a prosthetic guide as well. We all do this. And then we have a planning to engage the bone. Even in areas where I have a lack of buccal plate, if this is a 2B socket, as we have seen in previous master classes, this can be predictably regenerated, but always following the prosthetic guide, you see? So, this is the case that I will share with you by commenting the surgical video, because we have a surgical video, to understand how important it is in situations like this one, especially when we have the absence of buccal plate or we have a preserved buccal plate, how important it's going to be preserve the original architecture from the beginning by doing atraumatic extractions, right? So this is a tooth that needs to be extracted right here, right next to an implant. So this tooth has been fractured. This is the orthopantomography that I take from day one. This is the CT scan, right? And whenever we're doing something such as immediate loading, especially in the aesthetic zone, which is something very demanded by the patients, one of the things that I want you to download, because you can download it from my site as well, at the ebook download ebook section, is the dual zone concept from Dennis Tarnow, Maurice Salama, Steve Chu, Hanai Saito, a partner and colleague in NYU, that talks about the dual zone, right? And the dual zone is the area of the future rehabilitation that covers from the platform of my implant to the gingival margin, that is going to be the pink area, right? And the soft tissue area. And then we're going to have the area that goes below that platform, which is going to be the bone area, right? So we must understand this scientific paper to create the proper and most natural emergence profile, and also to preserve the original tissues if you're doing immediate loading. Why? Because once we extract a tooth, there is going to be a remodeling process. By extracting a tooth and removing Sharpie fibers that are attached to the bundle bone, will create